lifestyle factors: smoking, diet, and exercise. Now that's a whole show. Can you take next 6 minutes or so and talk about that chapter, please?
Yeah, these are huge topics.
Huge.
At this point, the fact that people continue to smoke cigarettes continues to astound me and most people I talk to because, all of us had smoked at some point. I remember the first time I smoked and actually threw up afterwards, which I think is a fairly common response. But, I wanted to be cool, so I was really willing to put up with whatever illness was required to get good at smoking. And I got really good at smoking. I got so good that I could not smoke for a while. And I had to figure out at some point, basically when my wife was pregnant with our eldest daughter, that I needed to stop that. And so one of the issues that I talk a lot about with my patients who still smoke, there are some, is what drives their ongoing smoking. And one of the weird things I find is that oftentimes it's habit, not chemistry. These are people who tell me, oh, no, no, I'm only smoking 5, 6 cigarettes a day. Now, is that a lot? Not in the grand scheme of things, but for them, they already have lung problems that make them more likely to have illnesses, pneumonia, those kinds of infections, respiratory infections. Oftentimes are the difference between someone in age 75 having mild cognitive impairment, just a mild case where they don't remember things as well, they're not as efficient as they should be, or then having an infection, which causes a whole chain of events that cause them to have the beginnings of dementia. So I look at them and I say, well, what is it? Obviously, it's not the nicotine at this point that's driving it because you're under the level that's typically addictive. And what we get into is these people who smoke, as all of us do, had developed habits that were part of our ability to take a break. Oh, I'll go and have a cigarette. Well, what they're really doing is they're having a break with a cigarette. And so if we can separate those two things, I actually teach something called sham smoking because this is what I learned when I was quitting. I'd gotten down to a point where what I really missed was the feel of the cigarette in my hand, the activities of tamping it on my watch. It was my buddy when I took a trip. It was the thing I reached for when the phone rang. It was all these things that were part of my life. So I got a pack of straws, drinking straws, and I cut them to the length of cigarettes, stuffed them into an old cigarette pack. And every time I would have smoked a cigarette, I went through all the motions. I took out the straw, tamped it on my watch, put it in my hand just like I would, and pretended I didn't actually use a lighter because I didn't want to have the consequence there. But I went through all the steps of breathing through it. What I discovered was that part of the experience of smoking had to do with relaxing breaths. And I found that this really, I look sort of stupid to other people. I didn't care. But I used this technique because I wanted to beat this habit. And I knew that there were things I could do if I just kept myself learning these habits until they no longer had any hold on me. Because after a while, when there's no nicotine coming back, you decide I really don't have to do that anymore. I've sort of extinguished this habit. So anyway, smoking is one of those pathways because people who smoke have lung problems. People who smoke tend to also overeat, tend to also not exercise. There's a lot of things that go along with this. And we're always looking for where's that entry point in changing your behavior. It may not be that exercise can do it when you're still smoking because you're out of breath. So we got to work someplace, and smoking cessation is always a good place because whenever you can reduce the number of cigarettes you're smoking in a day, that's a better day than the other.
Chapter 6: sleeping, breathing, breathing while sleeping. Okay, it's all yours. Go right ahead, please.
Well, this is the secret sauce of dementia, in my opinion, or at least one of the secret sauces. It's unfortunately one that is overlooked very often, despite the fact that in my library, I think I have 35 different articles, scientifically developed articles,
Peer reviewed.
peer reviewed, published in very, very famous journals, showing a connection between lack of oxygen caused by not breathing well while you're sleeping leading to changes in how your brain processes new information, how the cells create adenosine triphosphate, otherwise known as ATP, which is an energy molecule. So that people who are not getting enough oxygen to their brain while they're sleeping are tired. They're getting up multiple times during the night to go to the bathroom because, strangely enough, sleep apnea is also related to nocturia, to multiple episodes of peeing during the night. There's actually a chemical chain of events that causes that to happen. The other thing that we now know is that when people are having interrupted sleep because they keep waking up to a low level during the night, they don't spend enough time in stage 3, which is deep sleep. And two things of importance occur in stage 3 sleep. Number one, memory becomes consolidated. So the stuff that you experience during the day forms more coherent memories while you sleep during stage 3. And secondly, there's a system called the glymphatic system, which is our overnight cleaning crew that comes in and flushes out the toxins, the waste products that build up from our thinking and mental abilities during the day. So all day long, we're thinking, we're creating great ideas and doing things. We're also creating trash. Well, the glymphatic system comes through and flushes that out at night during stage 3 sleep. So if you're not sleeping continuously, if you're not spending enough time in stage 3 sleep, that doesn't happen. Those waste products build up. You got trash overflowing in your mental house, and it makes it very hard for your brain to work properly. So there's a couple things that happen there, in addition to a variety of other problems caused by insufficient oxygen getting to brain cells.
Sure. If you wake up and you feel like you're, because I haven't had, I'm alcohol free 26 years now. So it's like waking up with a hangover, or you drank a little bit too much the night before and you're just groggier than hell. And it's like, that's what the feeling is, what Dr. Mitch is saying. When you're not in that stage 3, you're waking up, you're not waking up refreshed. That's what I used to feel. I'm sorry,
Yep.
Mitch. Go ahead.
No, no, true. And you fall asleep while you're watching the games at night.
Exactly.
And you fall asleep in the movies theater when you're trying to make it through a 2.5 hour film. And yeah, I've been there, done that. I've been on CPAP now for over 20 years.
Yeah.
So I see the difference. And I tell my patients that we're members of the same club. We both got sleep apnea. And that the good thing is there's effective treatments for this. And it's a matter of just, again, doing it on a consistent basis. But one of the other things, and I don't know if we talked about this last time, but do you know what percentage of people over age 58 have sleep apnea?
I do not.
50%.
Really?
Yeah, so there's this large
That
scale
weight with you?
study done about a year ago where 6,000 people from the general population all took a 1 night home sleep test. So they didn't have to go into a lab, didn't have to go into a hospital. They got this little gizmo that they put on their finger attached to their wrist, and they slept 1 night in their own bed. And all the information from that was uploaded. These are very accurate tests these days. And where these people come from, they came from places like the Framingham Heart Study, the Mayo Clinic, very reputable places that every couple years bring in a new cohort of middle-aged people, and they test them in a variety of ways and follow them through the course of their lives every several years. So these are not special people. These are not people with cognitive complaints. These are people like general people. Anyway, so they decided that these, I think, 7 different groups were going to form a consortium. They're going to pool their data. And they came up with 6,000 people, huge sample size. And half of those people have at least mild sleep apnea. In other words, 5 times or more every hour while they're asleep, they either stop breathing or their oxygen level drops by 4%. Those two things together determine whether or not you have sleep apnea. I found that to be the most startling information I've ever seen because it tells us we're missing most of those folks. We should be screening for this starting at age 50 in everybody every 5 years, just like you get a colonoscopy. You also ought to get a sleep study. It's cheap, it's easy, it's 1 night.
Dr. Mitch, how would you like people to connect with you, find you and Emily, perhaps get some diagnosis or some treatment, please, speaking engagement, go right ahead. Take your time and share all of your contact info.
The easiest, most direct way is our website. It's called Brain Doc, BRAINDOC. And that'll allow people to ask questions. We have a number of podcasts, none as good as this, but we have a number of podcasts on there that answer a variety of different kinds of things. We have a link to our book on dementia prevention. So if people are saying, how do I get a hold of this? It tells you how to either order the book or download it on Kindle or get an audio book. I mean, it's all through that. And we also have a way of connecting with us on email. And the most exciting thing for me right now, I think, is this new dementia prevention checklist that we have online that people can take, and it's going to generate for you your dementia prevention plan.
When you go to the dentist and get a cleaning, having regular cleanings, there's a really good reason for that other than just your teeth. I mean, there's more things that go on with the doctor, with your hygienist. Can you talk about all of the other parameters that go into that, please?
Thank you. Yeah, that's one of those things that most people don't think about, but dental hygiene is mental hygiene in some ways. That because as we get older, especially, we start to experience more problems with our teeth and our gums. And so the everyone says, well, I want someone who's got deep pockets. Well, in your mouth, you do not want deep pockets between your teeth and your gums, because if your gums begin to recede away from your teeth, that's when various bacteria get in, and those create inflammation, and which we don't want in our mouth because it's so close to our brain and so connected to various other aspects of our body, but we don't want the development of bacteria that can cross the blood-brain barrier and cause inflammation in our brain. So I tell people the key here, aside from going to see your dentist on a regular basis, is you want to always use the F word. And they look at me like, what do you mean the F word? I said, yeah, the F word, because my dental hygienist taught it to me. It's called floss. And they say, oh, that F word. I say, yeah. But you know something, the thing about floss, and I discovered this for myself. I used to hate to floss because I've got to get the string and you try to go around and squeeze back in and get your fingers back in there, and it never works out right. And your mirror is covered with spit, and you say, this can't be good. I don't want to do this again. And then I discovered these dental picks, these little plastic curved things, so that you go in through the front. You don't have to go around the back and in. And they're easy to use. You can keep them in your pocket. They even have little carrying cases. I love these things because they go everywhere, and you eat and you can just get the food out from between your teeth. And suddenly your gum health improves and your pockets recede so that you now have, better gum health, and you've now improved your brain without even thinking about it. You also have better teeth.
Metabolic and vitamin deficiencies. Dr. Mitch, would you please set this up here, and I'll give you the signal when we're getting close to break. But that's a that's a big part of the dementia risk model, part two of your book. Would you please set that up?
So this is stuff that most people don't appreciate because they're looking for something they can buy over the counter that fixes their brain. And I got to tell you, it does not exist. So all those commercials you're seeing where people are saying, "Oh, I now have the memory of an elephant." Guess what? That's placebo effect. There's no evidence that those things work. So
Finish the thread with the vitamin deficiencies, and there was something else that you wanted to add as well, and I'll let you go ahead and talk about that. Go right ahead.
well, the vitamins and the medications that people take over the counter, a lot of those things are included right in the dementia prevention checklist. They're also in the book, including some of the over the counter medications that people take, especially for sleep or medications that they might take to help them relax. I mean, there's just a variety of things out there, but some of these can actually interfere with your thinking. And so we concluded a link to an online ability to check how much anticholinergic effect there is. An anticholinergic effect is when a chemical in your brain, acetylcholine, which is important for thinking and memory, gets suppressed because of medications that you take. And so some of the things that we take, like all the PMs, the medications that are such and such PM to help us sleep, are very anticholinergic. They dry us out. So are some of the medications that we take for colds or allergies. Some of the medications that are prescribed for urinary incontinence. Somebody's peeing too much, well, they take one of these. And these can add up and actually can get in the way of thinking effectively. And changing the way in which we get these can make a difference in how we think. But
Absolutely.
when
Go
you were
ahead.
talking before about, how do you get motivated to do these kind of changes? And I want to tell you personally that having a parent with dementia is a very motivating kind of thing. It's not my ideal way of learning about this, however. This is not the kind of thing you want to seek to have, but I feel for the people like me who belong to this club, adult children of parents with dementia. We have seen what effect it has when our parents got older and they began to have problems thinking and remembering, and their personalities changed. And our role with them went from being the child to becoming the parent. And one of the things that I think is so powerful is if you test people like I do or know people like I do who have got dementia, you look behind them and you have a whole family of people who don't want to have dementia. And that's a very important audience because they've seen what it does and they're motivated to say, what can I do now to not end up like that then?
But what are some of the takeaway tips that you really want to leave with people from today's episode?
Number one, as we are living longer, we have to be living healthier in order more to have our brains work the entire time throughout our life. Nobody wants to live to be 90, but not remember the last 10 years or be able to function. And that starts really earlier. Just very recently, on my side, within the last day, I saw new studies showing that the rate of dementia is going to double in the United States over the next 20 years or so. Well, that's going to be catastrophic. It's sort of like a climate kind of change in that at certain points it becomes unsustainable. We simply don't have enough people to take care of the people who are living longer and are unable to function. So even if it was from a societal point of view, you want to do something, but from a personal point of view, now's the time to begin. This is something which you could integrate into your life that will be healthier for you. You can't always prevent dementia. We could reduce the risk by 50%. There's half of those people who are going to develop dementia anyway. And that's simply out of the realm of our understanding at this point. But if you want to really increase your chances of being on the good side of that, now's the time to educate yourself. Now's the time to begin to make a plan and to start making small changes that you can repeat day after day after day because they become big changes over the course of time.
Exactly.
So our our website is sort of the central place we send people. Braindoc.com is the name of it, BRAINDOC. It contains contact information, a checklist, access to the book, a lot of articles, a lot of podcasts. But we welcome input. Please, there's a section you can send us questions. Please do. Happy to answer questions.
Dr. Mitch is a great resource. I mean, prevention checklist. Get that. Vanessa's going to have to pull out that segment 3 on the sleep apnea because that's really important. That's a key, and you got to get that test. You got to get that sleep apnea test. Take it from a guy with sleep apnea. I'm telling you guys. I'm telling you. You just don't know. I didn't know, and it was like I thought it was normal, and I'm abnormal, and amongst many other things. Anyways, thank you so much for subscribing, joining, listening, following, support. Please support our sponsors. Please support Brock. Please support Craig, Ameriprise, Keller Williams. If you're in other parts of the country, do that thing. Okay. Until next time, everybody, I'm Papa Tom. Go check out some of my dad talks on TikTok or on Instagram or wherever the heck you want to go, because they get kind of hilarious sometimes. Until next time, peace out, everybody. Love y'all. We'll have a good day. We'll talk to you next time.